Good morning, everyone. We'll start today's COVID-19 briefing with Mayor John Cooper and Dr. Alex Jahangir, Chair of Nashville's Coronavirus Task Force and Chair of the Metropolitan Board of Health. We'll also be joined by Dr. Gil Wright, Interim Chief Medical Officer for the Metro Public Health Department, and LaTanya Channel, State for Tennessee for the SBA, Small Business Administration. Here to help answer our questions today will be Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department. Now we'll begin with Mayor John Cooper.
Good morning, Nashville. I'd like to start today's briefing by reviewing COVID-19 progress and then followed by an update on vaccine rollout, and then an update on our recovery efforts on 2nd Avenue. Yesterday afternoon, Tennessee reported its 10,000th COVID-related death. That's less than a year since the pandemic took hold here in our state. Every life lost to the coronavirus is a tragedy, and we mourn for every Tennessean who has died. Now, despite this grim milestone, Nashville's COVID numbers have steadily improved, and Nashville's case fatality rate remains at half that of the state. Today, Nashville is reporting 3,300 total active cases. Now, that's a 31% improvement over the past 7 days and a 61% improvement from a recent peak on January the 11th. Our 7-day average of new cases per 100,000 residents is 42.4. That's down from 72 last Thursday and a peak of 93 on January the 4th. Our 7-day positivity rate is 8.2%, and that's down from 11.2% just last week. And our transmission rate, which represents the ability for the virus to spread, remains at 0.83, well below our target of 1. Now, on Monday, I joined Dr. Adrian Battle to announce the return of in-person learning at Metro Public Schools, that option of in-person learning, and that is starting today. Metro Schools' COVID score is currently 6.3, which is our metric for gauging that students and teachers can safely return to the classroom. Now, with a large appropriation of money from the federal government, our schools have the resources and the federal support that they need to open safely. And Metro Schools now has as the mission to help all its students recover from a challenging academic year. And it's going to provide a plan for full recovery for every student. Hopefully by the fall of 2022, we'll all be back on track. Now, we must continue to reduce the spread of COVID by continuing to wear masks, social distance, and avoid crowds. Your healthy habits are helping our students get back to their classrooms and also protects lives. And now an update on Nashville's vaccine rollout. Overall, in Nashville, 42.3% of our 75 and over residents have started their vaccinations. Now that is up from 23.8% just last Thursday. We are nearly complete with all non-senior phase 1A1 first responder vaccinations and are 30% through phase 1A2 healthcare workers. 104,695 total doses have been administered in Nashville by all health providers, including our hospitals and nursing home partners. Our own public health department has administered 21,440 of the total doses in Davidson County. Nashville has the largest phase 1A and 75 and over resident populations in the state at roughly 109,000 people. And public health is working with our hospital and partners to ensure a fast and efficient vaccination process for all 25,000 of our teachers and childcare workers who are in phase 1B. And those vaccinations are to begin as soon as possible. Getting our educators vaccinated is a priority. But the timing of our vaccine phases depends on the amount of vaccine Nashville receives from the federal government through the state. Metro is expecting a steadily increasing supply of doses each week. And this week, quite happily, we've received 9,000 doses instead of the 7,800 we were allotted. Now, the amount we can expect to receive each week can change on a daily basis, but we hope it continues to grow. And we will continue to use every dose we receive as soon as we receive it. Metro is committed to making sure that everyone in our community has access to the vaccine and the confidence to choose immunization. 19.1% of Black Nashvillians 75 old and older have started their vaccinations. Now that's up from 8.7% 3 weeks ago. Vaccinations among our Hispanic residents 75 and over has grown from just 2% to 23.4% in the same time frame. These numbers are moving in the right direction, but we will do more to help all Nashvillians overcome vaccine hesitancy and other barriers to immunization. We will continue providing vaccine doses to federally qualified health centers, including Matthew Walker Neighborhood Health and the Siloam Health Center. As we get more vaccine, we will provide on-site vaccinations in different communities as part of our plan to keep our most at-risk residents healthy. Now, Dr. Gil Wright is here this morning to discuss the vaccine rollout in more detail and to discuss the progress at the new Music City Center vaccination site. And then last week, the U.S. Small Business Administration announced that it would make disaster loans readily available for residents and small businesses harmed by the Second Avenue bombing. The disaster loan program allows homeowners, renters, and business owners to apply for low interest, long-term loans to help their recovery and rebuilding efforts. And this morning, I want to welcome LaTanya Channel, Tennessee's SBA State Director, and Julie Garrett from the SBA, who will provide more details on the different loans that are now available. To apply online or learn more, visit disasterloan.sba.gov or call 800-659-2955 7 days a week from 7 a.m. to 7 p.m. SBA loans are one of the financial assistance options that Metro is pursuing with the help of our federal partners. It's an important option that can help Second Avenue neighbors successfully rebuild. And today I'm pleased to introduce this week's well-earned community heroes. These heroes are the COVID-19 vaccination staff at Metro Public Health. For over a month, public health nurses and staff have administered vaccines to our frontline healthcare workers and 75 and older neighbors safely and efficiently. I'm grateful to them for the work they do to keep Nashville healthy. And now I'll turn it over to Dr. Alex Jahanger, Chair of the Metro Board of Health and the Metro COVID-19 Task Force.
Thank you, Mayor. Good morning, Nashville. Here's the latest on coronavirus. Active cases now are at 3,300. This has dropped 1,474 since last week, and this is the lowest this number has been since December 10th. This makes our total cases in Nashville 85,458, up 254 from yesterday. A rolling 14-day average is 346, and the cases continue to decrease, this number dropping from 97 last week and 238 just a week before. The 7-day average of new cases per 100,000 residents is 42, dropping 16 since last week. This is the only metric that we now have in the red, and we need to get this below 25 to go to yellow and below 10 to get to green. The 7-day positivity rate is 8.2%, dropping from 11% just last week, and this metric is now in the green. Total tests in Davidson County are 937,000. More than 400,000 of these tests have been conducted at our community assessment centers. And the transmission rate is 0.83, again, similar to the week before. Hospitalizations are also improving in Middle Tennessee and in Nashville. In Middle Tennessee, there are 450 people admitted to the hospitals, down from 615 just last week. And in Nashville hospitals, there are 280 individuals admitted with COVID-19 currently, down from 318 just last week. And yet 593 Nashvillians have died because of this disease. And now the vaccines. As the mayor noted, Davidson County continues to be in phase 1A and 75 and over. So far, close to 52,000 Nashvillians have received their first dose. That's 12,000 more Nashvillians receiving their first dose this week as compared to last week. And that's 7.4% of our population have now been vaccinated or have started the vaccination process. And of these 52,000, more than 24,000 have received their second dose. Also, of the 52,000, 14,000 residents are over the age of 75. That's 41 to 42% of our county's population. 34% of whites over 75 have been vaccinated, and 19% of blacks over 75 have been vaccinated. And of our Hispanic ethnicity, 37% of non-Hispanics in our county over 75 have been vaccinated, and 23% of people of Hispanic ethnicity in our county over the age of 75 have been vaccinated. Dr. Wright will add more information regarding our vaccine rollout. But to deliver the vaccines, we have partnered with many city partners and health systems. And we'll continue to establish these partnerships as the time comes on. And these partnerships will include working with trusted partners and that serve historically underserved communities, partnering with our churches, partnering with businesses that have offered spaces, and partnering with immigrant outreach communities. Just as we reached out to these community partners when we were establishing our testing and messaging strategy early in this pandemic, we will do the same with our vaccination program. As the supply increases, we will be ready to give more and more vaccine out into our community. So numbers continue to be encouraging. 5 metrics are green, 2 are yellow, and only 1 is now red. And they are improving, and we need to continue to do the things that we all know work. So stay apart, keep your distance, wash your hands, and wear a mask. And regarding masks today, I'm wearing one that says, "Thank you, nurse, wear a mask." And I just want to thank all the nurses with whom I work with, but specifically Laura Varnier, who is our Director of Nursing and Clinical Operations at Metro Public Health. Ms. Varnier's planning and diligence has just allowed us to have the vaccine rollout we have had and all the operations that we currently have. Also, remember, if you get exposed or you're concerned about getting exposed, get a test. And if you test positive, don't forget about monoclonal antibodies. It can save your life. And I really appreciate that our media colleagues are getting this message out now in our community. Monoclonal antibodies save lives. And remember, when it's your turn, take your shot, get the vaccine, encourage others to do so, and get the protection we all need so we can get back to normalcy. Finally, remember, it's Super Bowl weekend this weekend. Don't be smart about it. I'm not going to say who I support because it's not the Titans, unfortunately, who I wish was in the Super Bowl. But in all sincerity, be smart. Let's not do something that we'll regret 2 to 3 weeks from now. So thank you so much, and I'll turn it over to Dr. Gilwright.
Thank you, Alex. Good morning. I know there continues to be interest about the new coronavirus variants that have been found in several states, including Tennessee. We remain in close contact with the Tennessee Department of Health, as we now have 2 confirmed cases of the new COVID variants here in Nashville. These new variants have been found in 37 states, including Tennessee, and have shown to be 30 to 70% more contagious, so we can't let our guard down. Take precautions that we've been recommending. In regard to vaccine, Health Department nurses and staff, with support from Hands On Nashville, continue to offer vaccine 7 days a week at our site at Music City Center. We'll continue to offer vaccine only to those in phase 1A1 and 1A2, as well as those 75 and older. We've moved all of our vaccinations to Music City Center. We're no longer providing vaccine at Lynn's Public Health Center or our location in East Nashville. Vaccinations offered at Music City Center are by appointment only. Please do not come if you don't have an appointment, as you will be turned away. We're making progress to reach those in phase 1A1 and 1A2 and to those 75 and older. We'll do all that we can to move as quickly as possible through that group. We're feeling more comfortable with our supply of vaccine and look to move forward with school vaccinations in the near future. We'll work with our school partners when we're ready to make an announcement. Nearly 105,000 doses have been given in Nashville, and I'm unaware of any significant adverse events related to receiving the vaccine. We're seeing a small percentage of individuals have symptoms that are common after the second dose. These include body aches, low-grade fever, fatigue or tiredness, headache, and a sore arm that lasts for less than 2 days. These minor symptoms continue to reassure us that this is a very safe vaccine. The Tennessee Department of Health announced earlier this week that they have lowered the age group to receive vaccine to those 70 and older. We will not be moving to that group until we have reached all of those on our waiting list for 75 and older. This week, we reached 1,200 of our 75 plus waiting list and have scheduled appointments for 400 of those. Over 40% of those that we contacted had already received vaccine from another provider. For those of you who are 75 and older and have signed up to be on our wait list, I ask you to be patient. You don't need to sign up again. We will be contacting you shortly. Health department staff have been contacting people on this wait list and scheduling appointments as quickly as we can. And for those, again, I just say be patient as we will get to you. One of our main focuses is reaching our communities of color, including immigrants and refugees. The health department is following the same successful approach on vaccine that we used to increase testing in these communities. We've already begun working with community partners to provide vaccine through FQHCs, as well as through Meharry Medical Center. One part of our approach that is still being developed is to work with our community partners to offer appointments in both North Nashville and Southeast Davidson County and have public health department nurses administer the vaccine, just like we have with our mobile testing events. We're eager to broaden our reach to get doses into arms in all areas of Davidson County. How quickly that happens depends upon our access to shipments of vaccine. I look forward to the day when vaccine can be found throughout our community. Now I would like to introduce LaTanya Channel, who will address us from WebEx. Thank you.
Good morning, everyone, and good morning, Nashville. I want to once again thank Mayor Cooper for asking me to join you today. I think it's important that we get this information out as quickly as we can so that the public knows the correct information. And I also want to repeat what Mayor Cooper started out providing to you, the information, the basic information as it concerns the disaster relief available to businesses, also available to nonprofits, also available to homeowners and renters. Typically with SBA, you know that we provide assistance to businesses only. But in times of a disaster, particularly a natural disaster, as the December 25th explosion was, we also provide assistance to homeowners and renters. So what does that assistance look like? So let me just, I'm sorry, real quickly, I forgot to acknowledge my colleague, Julie Garrett, is here as well. Just so you know, we are located in Nashville, the SBA Tennessee District Office. Me and my team are here physically, working from home, as you can tell. And whenever there is a local disaster, our SBA Office of Disaster Assistance in Washington, D.C. will send a team to that location and will send a team of people. So Julie Garrett has been working here locally. She's working from home as well to provide assistance for this. So she's on the line as well. But let me just start again with what Mayor Cooper already mentioned. The type of assistance, particularly for this explosion, any type of natural disaster, if you remember, we did the same for the tornadoes, is loans. And these are very low interest loans, again, available to businesses. And again, this is businesses of any size for one type of assistance, small and large, homeowners and renters and nonprofits. So first things first, the website that Mayor Cooper mentioned, disasterloan.sba.gov. That is actually the actual website where you can go to apply. The phone number to the SBA Office of Disaster Assistance, where you can speak to a person who can help you with that process, is 800-659-2955. I also want to let you know of a new form of assistance directly for you that has been added. Since we are in this virtual environment, you can send an email to the SBA Office of Disaster Assistance and schedule an appointment. And that way, you don't have to muddle through the 800 number. You can actually make an appointment to have an actual person to deal with you and help you through the process and answer your questions one-on-one or take a deeper dive. And that email is F as in Frank, O as in office, C as in cat, E as in Edward, hyphen, help at SBA.gov. So that's FOCE hyphen help at SBA.gov. Now, I know that's a lot of information I've thrown at you. I'm going to give it to you again at the end of this. And I'll also make sure you have our local phone number. So if you didn't catch it, you can call our office here locally in Nashville and get that information to our Office of Disaster Assistance. So again, these are low interest loans for those that have been affected by the explosion. So this includes two different types of loans. First, there are loans available for the physical damage that was actually caused that day. And please also be mindful that if you weren't directly on 2nd Avenue, but there was physical damage, please know that you are eligible as well for that particular type of physical damage loan. Okay, and again, this is the one time where physical damage disaster loans are available to businesses of any size, not just small business. Physical damage disaster loans are also available to homeowners and renters. And I also want to let you know that does include damage to automobiles. Okay? As far as interest rates for those physical damage loans for homeowners, those interest rates are as low as 1.1% for homeowners and renters. For businesses, as low as 3%. For nonprofits, as low as 2%. So in addition to the physical damage loans, and remember there are two different types of assistance, two different types of loans that help with your long-term recovery, physical damage and economic injury. So for economic injury, this is the one type of disaster assistance that's available only to small businesses, okay? So for those loans are 3%, and also nonprofits as well, at 2% rate. Yes, one entity is eligible for both types of loans, for physical damage and economic injury. I also want to leave you with this information as well. As it concerns the economic injury disaster loan related to this explosion, please know that that applies to businesses that may not be on 2nd Avenue. This declaration extends to also counties that touch Metro Davidson County. So there was tremendous power outages that occurred for several days. If a business was impacted by those power outages, they couldn't open. It affected their ability to do business because of those the phone outages, the internet outages, or any power outages that may have occurred. Then you are eligible for an economic injury disaster loan for your business. Okay? There's a lot of information that I've thrown out to you at once. I do also want to let you know that tomorrow on Friday, as well as next week on Wednesday, February 10th, we're doing 2 live information sessions and Q&As for anyone that believes they were impacted as a result of the Nashville bombing explosion. You can call my office directly so you can get that information. It's going to be online. It's going to be virtual. You can either call in or you can log in from your computer. And you can just call my office at 615-736-5881. You just get the phone number for that and also the login information for those information sessions. Let me just double check my notes. So deadlines. So deadline for the physical damage loans. Remember, 2 different types of assistance. That deadline is March the 29th, coming up pretty soon. And the deadline for the economic injury loan related to the explosion is October the 20th. Again, so let me just check my notes to make sure I didn't miss anything here. It's too critical. So I think I've covered just the basics. And again, I just want to remind you, we are doing a deeper dive information session. I also want to let you know we'll take any live questions on those sessions on tomorrow as well as on Wednesday. So again, let me give you the contact information so you can apply if you think you are eligible, and the contact information so you can call and get your questions answered if you're not sure. So the website to apply and get information is disasterloan.sba.gov. The phone number to the SBA Office of Disaster Assistance is 1-800-659-2955. Now, for those of you who have used that phone number before, For idle, as it relates to COVID, please know that there's a special staff dedicated just for to address the needs of victims who need assistance as it relates to the explosion. So you should not have as many delays as you might have had for calling that number for COVID. Again, that's 800-659-2955. Available 7 days a week from 7 a to 7 p Central Time. And again, that email address, if you want to talk to someone directly to handhold you through the process or just answer your questions, you can make an appointment by sending an email to foce-help@sba.gov. And then finally, my local office number is 615-736-5881. Our local SBA email address is tn@sba.gov. And everything I've shared with you, you can get the same information by calling our office. Someone answers our phone every day from 8 a.m. to 4:30 p.m. We can get you the information to connect you directly to the Office of Disaster Assistance and information on the upcoming information sessions. So thank you once again for having me so we can get this critical information to everyone.
Thank you, LaTanya. We'll now start taking media questions, starting first with Julia Palazzo with Channel 2. Good morning, Julia.
Good morning. Thank you, Brian. A couple questions for Dr. Wright. You mentioned 2 cases of the variant in Nashville now. Now, I just wanted to clarify, these are 2 separate cases from the 2 that the state confirmed a few days ago. And are you able to say which variant it is? The UK, South African, Brazil? And then just to roll back onto the topic of the vaccine rollout, just being one of the only few counties still doing 75 plus. Do you have concern about the differing phases compared to the rest of the state? And since the population's higher in Davidson County, it's taking longer to get these categories done. Do you think the state should be allocating more vaccine to Davidson County? Thank you.
Thanks, Julia.
Thank you, Julia. These actually are the two state reported cases. They are both the British version. We do know that the vaccines that are currently available, both Pfizer and Moderna, work well against this variant. So that shouldn't be an issue at this point in time. As far as being on a different schedule than the state, we always knew that we would probably, areas of the state would be on different different phases at different times. The state's trying very hard to coordinate that, at least as closely as they can, but almost all of the metro areas are lagging behind a little bit with where the state is. Yes, we'd always take more vaccine if they provide it, but I understand that they have they're still limited, but they do seem to be making good progress to provide us more each week. So that I'm happy for.
Thank you. Our next question is from Harriet Wallace from Channel 17. Good morning, Harriet.
Good morning, Brian, and good morning, everybody there. I've got a few questions. The first, I guess it would be for our health department. If you can, we've had some discussion and concerns about, you all even referenced it today, about vaccination in our communities of color in Nashville, particularly in the Black community. If we could talk about why we're seeing those numbers so low and the efforts that are being made to improve those numbers across the board. My second question, this is looking at going back to the Christmas Day bombing, just to follow up. There have been some concerns about what happened with the 911 call center and the location of that call center, the data building there, and limited protection of it. This question is for Mayor Cooper. Your thoughts about that? Do you believe that building is poorly located, and what efforts could be made to better protect our 911 call center moving ahead? And I've got one more question. This is related to the pandemic again. Do you all foresee the state possibly raising the unemployment insurance business tax due to use of the CARES Act money? If so, it's been a hard year for our businesses. How can the city support them if they have to pay that tax increase? Thank you.
Thanks, Harriet. We'll start with Dr. Wright, we'll start with Dr. Jahangir, and then we'll answer your other questions.
Harry, thank you. So I think I want to highlight some of the numbers I mentioned earlier. 41% of our seniors over 75 have been vaccinated. 34% of seniors over 75 that are white have been vaccinated. And 19% of seniors over 75 who are Black have been vaccinated. And 23% of seniors who are of Hispanic ethnicity have been vaccinated. I'll be the first to tell you, I mean, I think, yes, we want to try to get these numbers higher and higher, and we're doing that through a concerted effort and partnership. So to answer your questions about what efforts are being conducted. So one is through partnerships. So we've talked several times about our partnership with Meharry Medical College, and when they have a vaccination fair, for lack of a better word, that's one way to get in the community. Partnerships with our federally qualified health centers. Partnerships going with some of our council members are really providing us a good partnership to help us into getting into places. For example, yesterday we went to a retired teacher's home, I believe is the name. And then now, as we're starting to get a more clear sense of where our vaccinations are, what our allotments are, there's Dr. Wright and his team are talking to churches and in our immigrant populations, working with community organizations there. So this is top of mind, I can tell you, for me, for Dr. Wright. I know the mayor, when we talk about this, and it's something we're going to continue to work on. I think the fact that we've increased our percentages from single digits to now 19 and 23% is a good start. It's not the end by any means, but it's going to take all of us to come in and work together, be honest with the data, not throw shots to make points. And by doing that, I think these numbers will continue to increase. And the final point of this is messaging and making sure that vaccine hesitancy, which is a very, very valid concern for me, is that education is provided. And that's going to also take a lot of people, including you all as the media, and helping us get the right message out in all languages. So thank you.
Well, and thank you, Harriet. Let me appreciate the call. Tackle these two other questions on the Christmas bombing, the 911 call center. I don't think that's actually, it's the regional switch that kind of is in front of our 911 call center. So it's not the call center itself, but it is this important infrastructure that would help serve the 911 call center that obviously was vulnerable and had an interruption. In looking into this, interestingly, lots of cities apparently do have regional switches that are located in relatively unsafe environments, general environments. And I do think it's going to be a priority by the Department of Homeland Security on a national basis to undertake the plan for hardening this kind of critical infrastructure. AT&T is in our facility here is not unique. I actually had thought that we were relatively uniquely vulnerable by the placement of a regional switch downtown. I'm told that happens a lot. And I think the federal government, and talking to congressional leaders on the Homeland Security appropriations part of the process, I think are accepting it as a national challenge, of which Nashville is probably going to be an emblem for that, is what are we doing on our critical telecom infrastructure, and is it safe and secure enough? Now, your second question about Tennessee conceivably having a state tax increase, I will say that state revenues are up. In Nashville, they're down some, but in the state they're up, and they have cut expenses a lot. So I would hope that they're in a position not to have an additional tax increase on anybody. I would hope that that's the case, and that we can manage forward with CARES money to protect all of our businesses when possible. But thank you.
Thank you. Our next question comes from Brett Kelman at the Tennessean. Good morning, Brett.
Good morning, everyone. As Nashville has teacher vaccinations on the horizon, I'm curious how Mayor Cooper and Dr. Jahangir feel about the fact that the state's priority listing has no place for college professors, of which in Nashville we have many, and other college staff. My understanding is it would face the same, if not increased, risk as grade school teachers, but are nowhere in the hierarchy of vaccine rollout. Do you have thoughts on that? And is there anything the city can do to change it if it so wants to?
Thanks, Brett.
Hey, good morning, Brett. You know, that is, as you said, from the state, and it's a policy decision on the phasing. There are a lot of groups that I think are going to be that we would like to have at the top of the list, right? And you're right, we have a lot of great college professors in town, but they're not part of the phasing right now. But here's what I would say is we need to sometimes also get out of the profession of what an individual is and look at the phasing when it comes to age, and also phase 1C, which we hope to roll to as quickly as we can get through 1B, will hopefully open up anyone over 16 and older who have any medical problems. So if there's a college professor that has hypertension or autoimmune disease or something like that, hopefully they can get vaccinated in 1C. I think the phasing part of it is there's some really tough decisions that I know the state has made, and frankly, I speak with the state, and Dr. Wright does pretty regularly too, to see if, hey, mate, what's the thought process behind this decision, or could we add this group and so forth? And it's not easy, but my opinion right now is the phasing criteria the state has set seems reasonable. We're trying to get there as fast as we can, and that's kind of where I stand on it. Thank you.
Our next question comes from Yoon Jong with the Tennessean. Good morning.
Hi, good morning. I got some questions for Dr. Wright. I know this is largely contingent on supply of vaccines, and he mentioned going through the wait list before including 70-year-olds. But is there a specific percentage of people in a phase that need to be vaccinated before the city decides to move to the next phase? And how does this factor in people who may not be interested in getting a vaccine? When it comes to schools, will vaccines be rolled out in a certain order of grades or priority? And how does the city plan to vaccinate our residents experiencing homelessness who may not be, signing up for our wait list or coming through to get vaccinated at other sites? Lastly, I know Dr. Wright mentioned the 2 cases of the new variants. Is there any special contact tracing work the department will do due to the fact that they're more contagious than a normal virus? Thank you.
Thanks.
Thank you for all those questions. The percent of the population that is currently vaccinated or received at least the first vaccine is about 7.5%. It's going to take us a while, but as we receive more and more vaccine, we will get to those and quicker. Schools, we're just finalizing our plans for that. And we've looked at a number of different ways to move through the schools such that we are able to get through them in a reasonable way. One of the discussions was to start with kindergarten and work our way up, but we haven't finalized those completely yet. So yes, we are considering all those different options. Finally, discussion on the homeless population. We will be working with homeless population. It's another community group or group of individuals that we'll need to reach, and that may very well mean going out into some of the sites that they're in to give them. We've already started to look at a number of the housing availability that's here and how we're going to work through those buildings, those groups of people also, so that we can get them done. But it is in the plans.
Thank you. Our last question comes from Blake Farmer. Good morning, Blake.
Hi, yeah, my question is related to the age cutoff as well. So my understanding is there's a number of healthcare providers, Vanderbilt being among them, that have already moved to 70 plus. But when you talk to the state, they say that the sort of local providers need to stay within the phase that of the county that they're in. So has Metro Public Health sort of allowed, are you all aware that the other providers with vaccine have moved to the younger age bracket? And is there any concern there of
Thanks, Blake.
confusion or maybe unfairness?
Thanks, Blake. We'll have Dr. Wright answer that.
Blake, we are, I am aware of that in a couple of those instances. They have vaccine that is been allotted to those institutions. They've reached through their 75 group. They're running out of people that are coming in at this point to be able to get those vaccines. And rather than have a open appointments, if they have vaccine that they can use to put in arms, we would allow them to step down to the next group just to fill those appointments up while we work through the 75 plus group on our wait list. It will give us a little bit of a head start into the 70 plus year old group, but it's really done just because they're running out of their own staff or their own patients that they in that 75 plus group.
All right. Those are all the questions we have today. I'd like to thank LaTanya Channel for joining us today. And as always, we're grateful to Amy Lankheit and our partners at Bridges Heart of Hearing for providing the ASL translation at the press briefings. And our next COVID press briefing will air on Thursday, February 11th at 9:30 a.m. Thank you for joining us, and that concludes today's briefing.